You're sitting in a wooden chair in 1320 Paris, and the man sharpening his blade has 3 jobs today: shave 12 customers, pull 8 rotten teeth, and saw off a soldier's gangrenous arm. He'll use the same razor for all of it. You wake before dawn in a city where soap is a luxury and pain is a constant companion. By the time the sun is up, you've already watched your barber-surgeon slice, open a baker's abscess with the same knife he'll use to trim your beard. And what that reveals about medieval medicine is something that still shapes how we think about expertise today. Welcome to History Snapshots. This is what life as a barber-surgeon really looked like. The year is 1347, and across Europe, a peculiar professional dominates the medical landscape. He's not a university scholar. He hasn't studied Galen or Hippocrates. He can barely read Latin. But when a Flemish merchant breaks his jaw in a tavern brawl, when a pregnant woman's tooth abscess threatens her life, when a crossbow bolt punches through a soldier's shoulder, he's the one they call. His shop sits on a narrow street in Florence, marked by a single pole, painted in spiraling red and white stripes. Inside, the smell of soap mingles with blood and the acrid tang of cauterizing irons. This is the world of the barber-surgeon, and for the next 3 centuries, he will perform more operations than every physician in Europe combined. The barber-surgeon's day begins at dawn, not with prayer or study, but with the grinding of steel. His tools are simple: straight razors, fleams for bloodletting, tooth-pulling pliers called pelicans, bone saws, cautery irons, and curved needles threaded with silk or horsehair. In London, the Barbers' Company, formally chartered in 1308, regulates who may practice, but the barriers to entry are low. An apprenticeship lasts 7 years, but unlike physicians who spend a decade at universities in Bologna or Paris, barber-surgeons learn by doing. They practice on the poor, on criminals, on soldiers who have no choice. By 1363, the guild has split the trade: barbers who only cut hair and shave, and barber-surgeons who do everything else. The distinction matters because the Company of Surgeons, established in 1368, will spend the next 2 centuries trying to exclude barbers from surgical work and failing. Why? Because physicians refuse to do it. The medieval medical hierarchy is rigid. At the top sit university-trained physicians, men who diagnose through uroscopy, examining urine in glass flasks, and prescribe herbal remedies. They never touch patients. Manual work is beneath them, a violation of their status. Surgery is considered a mechanical art, not a science, fit only for craftsmen. A typical morning in 1350, Bruges. The barber-surgeon opens his shop at first light. His first customer is a wool merchant who needs a shave and a haircut. 2 pennies. While lathering the man's face, he discusses the second appointment: a bloodletting for a feverish clerk. Medieval medicine operates on the theory of humoral balance, the belief that health depends on equilibrating 4 bodily fluids: blood, phlegm, black bile, and yellow bile. Bloodletting is prescribed for almost everything, from headaches to plague. The barber-surgeon uses a fleam, a small blade, to open a vein in the patient's arm, collecting blood in a brass bowl. He'll take roughly 10 ounces, enough to make the patient dizzy. By midday, he's pulled 3 teeth. Dental decay is rampant. Honey and bread are staples, and no one brushes. Extractions are brutal. The patient sits in a chair, head braced against the barber-surgeon's chest. He grips the tooth with a pelican, a lever action tool, and wrenches it free. No anesthetic, maybe a slug of wine. The socket bleeds freely, packed with cloth, soaked in wine or vinegar. 1 in 10 extractions leads to infection. Some patients die, but here's the thing. This system works not because it's safe, but because there's no alternative. Physicians won't do this work, and barber-surgeons are everywhere. When war comes, and in the 14th century war is constant, the barber-surgeon's role transforms. The 100 Years' War, the Italian city-state conflicts, the endless feudal skirmishes, all generate a steady stream of traumatic injuries. A barber-surgeon attached to a French army in 1356 might treat 40 men after a single engagement. Crossbow bolts, sword cuts, shattered bones from maces. His toolkit expands: amputation saws, ligatures, boiling oil for cauterization. Amputation technique is straightforward and horrific. The limb is tied off above the injury with a tourniquet, a leather strap twisted tight with a stick. The surgeon cuts through flesh with a knife, then saws through bone. The stump is cauterized with a red-hot iron or boiling oil, a method taught by the Arabian surgeon Albucasis centuries earlier, but practiced crudely here. Mortality rates approach 80%. Most men die of shock or infection within days, but some survive. And those survivors spread the barber surgeon's reputation. What's critical to understand is this: the barber surgeon's authority comes not from credentials, but from visibility. He's there. He acts. In a world where inaction means certain death, even a 20% survival rate makes him indispensable. The physician safe in his study becomes irrelevant. By 1380, the red and white barber pole is ubiquitous across Europe. Its symbolism is direct: red for blood, white for bandages. Some poles feature a brass basin at the top, the same basin used to collect blood during letting or to lather soap for shaves. It's advertising medieval style, and it works. The barber surgeon's shop becomes a social hub. Men gather to gossip, to drink, to watch procedures. Public bloodletting is common, is considered routine maintenance, like trimming your nails. But the profession is not without tension. In 1376, the Company of Surgeons in London petitions the Crown to restrict barbers from performing surgery, arguing they lack training and endanger lives. The petition fails. Why? Because barbers are cheaper, faster, and more accessible. A physician charges a day's wages for a consultation. A barber surgeon charges pennies. For the vast majority of medieval Europeans, peasants, laborers, soldiers, the barber surgeon is the only medical practitioner they'll ever see. The exception, however, is telling. When a nobleman requires surgery, he sometimes hires a formerly trained surgeon, a man who studied under a master in Montpellier or Salerno. These men exist, but they're rare, expensive, and often no more effective. The barber surgeon's dominance isn't a failure of the system, it's a feature. The system runs on pragmatism, not purity. By 1400, the barber surgeon is an institution. He'll remain so until the 18th century, when surgery finally becomes a respectable science and the roles split for good. But his legacy lingers in that red and white pole, in the memory of a time when the most critical medical care was delivered not by the most educated but by the most willing. You're sitting in the wooden chair again, watching the same blade move from beard to wound to tooth. And the lesson is this: credentialing and expertise are not the same thing. The barber surgeon succeeded because he occupied the space others refused to enter, not because he was the best trained, but because he was the only one present. In your own world, watch for the same dynamic: the credentialed expert who won't touch the problem, and the uncredentialed practitioner who solves it anyway. Authority flows not to those who know the most, but to those who act when it matters. The barber surgeon didn't wait for permission, didn't demand a university seal, didn't let a status prevent him from doing the work. he picked up the blade. And in a world of hesitation, that made him irreplaceable. The question isn't whether you have the credentials, it's whether you'll be in the room when the work needs doing.